Hi, my name is Janie Roach, and I am a first-year clinical student at Glacier Hills Senior Living Community. I will be presenting to you a patient today. This patient is an 80-year-old pleasant Caucasian female. She is married and a mother of 3. Before she retired, the patient worked as a secretary and then was a full-time mother until her kids grew up and moved away. The patient has a close relationship with both her husband and her children, and is usually taken care of by a member of her family when she is not in the hospital. Patient was admitted to the hospital approximately 3 weeks earlier after a fall that resulted in a right distal closed femur fracture. Patient has pain in her right femur that radiates to her lower right leg, ankle, and foot. The patient fell on the same knee a year ago and states that she has had an achy pain in this leg ever since that is constant but that gets worse at night and during exertion. Patient rated the pain a 3 out of 10 during rest and an 8 out of 10 during exertion. Patient has notable edema in both lower legs. Patient was in a brace for the first 2 weeks after the fall and is now able to move around without help of a wheelchair and sometimes with a walker. Patient takes Tylenol and several prescription medications such as cytidiobenazepam to manage the pain. Upon examination, right leg shows significant swelling from the knee down and reduced mobility. Patient's past medical history includes arthritis, silent MI, chronic joint pain, hypertension, coronary heart disease, congestive heart failure, atrial fibrillation, respiratory insufficiency, and falls. All immunizations and flu shots are up to date. The patient is allergic to penicillins and codeine sulfates and suffers from hay fever in the spring. Past hospitalizations and surgeries include a right knee replacement, tibia fracture, cholecystectomy, tonsillectomy, and right knee dislocation. Patient is on numerous medications for pain, muscle spasms, CHF, depression, hypertension, constipation, and osteoarthritis. Patient states that she has no trouble sleeping and has balanced nutrition. Patient was a smoker 50 years ago but has not smoked since. The patient is happily married and has family that visits on nearly a daily basis. The patient has a home nurse that visits once a day when she is not in the hospital to help her carry out her activities of daily living. The patient attends church every Sunday and finds stress relief in her faith. Family history is limited due to patient's lack of information. The patient's mother and father both passed away from heart attacks. No family history that the patient is aware of. No family history of cancer that the patient is aware of. Patient had one brother who passed away in his early 20s during combat. Patient's children have hypertension but no other known illnesses. 2 systems that would be of high priority to assess would be the musculoskeletal system due to history of arthritis and falls that have resulted in fractures, and the cardiovascular system due to history of CHF and myocardial infarction. A musculoskeletal exam was conducted first on the patient. The patient had normal range of motion in her wrists, fingers, ankles, elbows, jaw, and neck, but had stiffness and reduced range of motion in almost all other joints. Patient had the most difficulty when attempting to move her shoulders, knees, and hips. The patient also had difficulty bending over without help from a physical therapist. Muscle strength was diminished in the patient's right leg, which is where her injury occurred, but has normal muscle function in all other areas. No crepitus, redness, or warmth noted in any joints other than the right knee. Patient is able to walk on her knee with the help of a walker or cane, but states that the pain is worse when she tries to use it. The patient stated she works with a physical therapist every day for several hours to improve her muscle function. A cardiovascular assessment was done next. The patient has an extensive cardiac history, including a coronary heart disease, myocardial infarction, and atrial fibrillation. A set of vital signs was not obtained due to patient's participation in physical therapy during the interview, but according to her chart, she normally has high blood pressure that is controlled with medication. Patient has slight pitting edema in both legs that is baseline for her. Heart sounds were taken in the 5 major areas: aortic, pulmonic, Erb's point, mitral, and thoracic, with both the diaphragm and the stethoscope. No abnormal sounds or murmurs noted. No heaves or lifts noted. Cap refill normal in hands and feet. All peripheral pulses found to be present, strong, and equal. 2 other systems that would be very important to study would be the respiratory system and the integumentary system. The respiratory system is important because it is directly related to cardiac function. Because this patient has reduced cardiac output, it is important to regularly monitor her respiratory function as well. Low oxygen levels or difficulty expelling carbon dioxide are very dangerous to a patient's health and both cause and react to reduced cardiac function. According to Critical Care Nursing Quarterly, Respiratory failure is a direct result of problems related to arterial blood gases. This connection between arteries and respiration is why it is necessary to assess the respiratory system as well. This patient in particular also has a history of respiratory insufficiency, which indicates a need for regular checkups of this area. Problems with respiration may also lead to changes in musculoskeletal function, as joints and muscles need oxygen to continue to work properly. The second system I would want to assess is the integumentary system. According to Topics in Geriatric Rehabilitation, it is important to assess the skin in patients with cardiac disease because they are prone to wounds that take much longer to heal and are easily infected. It is vital to regularly monitor blood flow to extremities to prevent ulcers, skin tears, swelling, infections, and other integumentary issues. Problems with skin surrounding joints and muscles can also cause inability to move said areas and can affect the patient's activities of daily living.